Good afternoon. I want to thank you for joining us here for the fifth of our 8 town hall meetings here at the Department of Human Services. Today we're going to be focusing on our Division of Aging and Adult Services. I'm pleased to have with me Kenyatta Blake Washington, our Division Director. Kenyatta.
Thank you for having me.
Glad to have you with us. Just a couple of housekeeping details. We will be taking some questions a little later. We did receive some in advance, and you are certainly welcome to send us questions during the town hall. The only caveat to that is we ask that they be on topic, they be about aging and adult services, since that's what we're going to be talking about today. So just to get us started here, Kenyatta, tell us a little bit about, and this is a mouthful to even say, the area agencies on aging. What are those?
Sure. So our area agencies on aging, we recognize in the aging community that local agencies and local communities know their older adults best. So our area agencies on aging, it stands for, well, we say AAAs, and they are the pillars and focal points in our community. They're responsible for providing those resources to older adults and administering all of our programs that we administer through the Department of Human Services.
Okay.
They're also
Go ahead.
They're also responsible for picking contracting agencies if they do not provide those services directly. So sometimes we do have AAAs who provide services directly, and also if they want to contract out with a different agency, then they can provide those services as well.
Okay, so my notes indicate there are only 10 of these AAAs.
Yes.
So there's not one in every county, obviously.
No, there's not one in every county. They are divided up by 10 different regions, and we refer to those as PSAs. So those are planning service areas.
Okay. And are the AAAs associated? I know we deal with the planning and development districts. Are the AAAs associated with the planning and development districts?
So yes, the AAAs are housed in our planning and development districts. They are the aging division within those planning and development districts.
Okay, so if somebody's already familiar with their local planning and development district, or their regional planning and development district, that's where they go to find their AAA.
Yes, sir, that's where they would go.
Okay. Well, let's talk about something called home and community-based programs. My understanding is that we as an agency received about $6 million in CARES Act funding for older adults.
Yes, sir.
And is that specifically for these home and community-based programs?
Yes, sir. That funding was from the federal government to implement those home and community-based services.
Okay, and what kinds of services do those include?
We have our older adult nutrition program. So under the older adult nutrition program, we have our home delivered meals. A lot of older adults in the community, they like to refer to it as the Meals on Wheels program, but it is our home delivered meals program. And this program provides a hot, frozen, or cold meal to a homebound older adult who is 60 plus. We also have our Congregate meal program, and this program is for individuals who are 60 plus, but they would receive at least one hot meal in a congregate setting, and this is to reduce hunger and also to promote socialization for that older adult.
So that gives them an opportunity to get out of the home and go meet with some fellow senior citizens.
Yes, sir. Yes, sir. They can get to socialize with other individuals in the communities at their congregate meal sites.
Which I assume during COVID they're not really being able to do very much.
No, unfortunately, since the COVID impact, our congregate meal sites are shut down at the moment, but we were able to transfer those individual meals to grab-and-go meals.
Okay. What is the Homemaker program under the Home and Community-Based program?
Our Homemaker program provides light housekeeping for older adults in their homes.
Okay. So just to help them keep their houses in good order.
Yes, sir.
And I'm familiar with, from time I spent at Medicaid, the adult daycares. But what are those? Just explain to our audience what the senior centers or the adult daycares are all about.
These are places also where older adults can go and socialize for recreational activities, also so they can encounter and just engage in the community with individuals that they enjoy. They also have activities. They do different crafts, arts and crafts. They also have their meals there as well.
Okay. And I have a note here that we also do some outreach through the home and community-based programs. What kind of outreach are we doing?
So outreach, we always consider outreach. A lot of people don't know that these services exist. So we do have individuals within our AAAs. They go out to health fairs and different events just to educate the community and older adults on available resources.
Okay, all right. Well, let's kind of walk the audience through a little bit of an overview of your division on the whole, the Division of Aging and Adult Services. And I'll just start with something called SHIP. What is SHIP?
So SHIP stands for State Insurance Assistance Program without the A. We always like to say that. And so this program provides free, in-depth, one-on-one health insurance counseling to Medicare eligibles, their loved ones, or their representatives.
Okay. So they help them figure out, like, if they're getting ready to qualify or to sign up for Medicare, help them walk through that craziness?
Yes, sir. Help them understand the daunting task of the Medicare system for their Part A, their Part B, C, and D. We also have a MIPA program that's an extension of the SHIP program, and MIPA stands for Medicare Improvement for Patients and Providers Act. And this individual program assists older adults or those Medicare eligible individuals with their prescription drug costs.
Oh, okay. Okay. So do we have, or is it the AAAs? Who runs the SHIP program?
So we do have certified SHIP counselors. These counselors are certified through CMS, and they are housed in our AAAs.
Okay. And so if anybody is needing to kind of walk through that minefield of Medicare A, B, C, D, and all that craziness, they go talk to a SHIP counselor.
That's correct. They'll talk to a SHIP counselor. They can call the MAC Center and speak to a SHIP counselor.
Okay. Do those counselors also help with, I know a lot of our elderly population, once they get to nursing home, thinking about nursing home residents, they need to consider Medicaid. So does the SHIP program also help them look at Medicaid issues?
They also help them look at those options as well.
Okay. What about the Lifespan Respite Voucher Program? What's that all about?
Our Lifespan Respite Voucher Program is an extension of a pilot program that we conducted with the Mississippi Family Caregiver Association or Coalition. And this voucher program provides respite care vouchers to those caregivers. We have an initial voucher that is $300. We have a repeat voucher that's $300. And we have an emergency voucher that's $400.
Okay. Now, respite may not be a word that everybody's familiar with, but we're talking about a break or just some relief from some, let's say a daughter or son or taking care of their mother full-time in the home. Is the Lifespan Respite Care Program, is it for them?
Yes, sir. It is for caregivers who are taking care of those individual care recipients, and if they aren't able to have any other services available, if they're not receiving other respite from other waivers, then they are able to take access to that program.
Okay. Does it include families, for example, where there's a disabled child that stays at home all the time?
Yes.
They're eligible for this program as well?
They're eligible for it as well because it is across the lifespan.
Okay. And how do they, if a family wants to know about the Lifespan Respite Voucher, where do they get the information? Who do they talk to?
They should call one of their local MAC centers, and MAC centers MAC center stands for Mississippi Access to Care, and they're welcoming places where individuals can obtain unbiased information on available resources. So once they call the MAC center, they should just ask a MAC center specialist that they would like to apply for the respite care voucher, and that specialist will know what they're talking about, and they'll assist them.
Okay. Are the MAC centers tied to the AAAs at all, or are they in the same place? Or?
So yes, we do have MAC centers in our AAAs.
Okay. Well, now, going back to the example I used, if, say, a husband and wife are taking care of one of their parents, does the respite voucher, does it pay them, or who does it pay exactly?
So it pays a care provider. The respite voucher does not pay the individual caregiver because we do want that caregiver to take a break. So it pays that individual provider if they have someone that wants to come in, or if they have a company, say a personal care company that they want to come in, it'll pay. We reimburse the individual caregiver for that cost.
Okay, so they bring somebody in to kind of take their place.
Absolutely.
And we pay the person who comes in to take their place.
Yes, sir.
Okay. What about if they've already hired somebody? Does the voucher help them if they've already hired a personal care assistant and that person is already in the home?
So unfortunately, it does not, but the individual can request that assistance, and then we can go back, and if they show where they've done the work, then we can pay that individual.
Okay. But generally it's for, you call in, you go to your MAC center and you say, I need some respite care, and we get you set up for a voucher.
Yes.
Is there an eligibility piece to that, or is it anybody? Does it matter how much income you have in your home?
It does not matter how much income you have in your home. We are not looking for that. We just want to assist individuals with that need. A lot of our caregivers today, they're unpaid. They're burdened with the work of taking care of those individual loved ones.
Right.
And so this is a program to help them.
So this is just, to make their life a little better.
Make their life a little easier. Yes, sir.
I kind of have a little more personal understanding of that. We have my 90-year-old mother-in-law living with us these days, and I think I may look into that respite care for my wife.
Absolutely.
She's about 24 hours a day right now taking care of her mom. So, well, now, your division also has something called the Adult Protective Services Program. Tell us a little bit about that.
So our Adult Protective Services Program, we investigate alleged abuse, neglect, and exploitation of vulnerable persons in a private home setting. These investigations are done to determine the validity of all of our reports that are made.
Okay. Now, in my prior life as a prosecutor, I prosecuted some vulnerable adult cases at the Attorney General's office, but they were all in the nursing home setting. The Adult Protective Service is not dealing with nursing home residents, right?
No, sir, it's not dealing in the private home setting.
So these are all folks who are still staying at home, maybe under one of the Home and Community Services waivers that Medicaid has, for example.
Yes.
Okay. When we talk about physical abuse, what kind of abuse, or what are some examples of that?
So those indicators are slapping, biting, any type of physical bruises that you see on that individual.
Okay. And I hear the word neglect a lot. What do we mean when we talk about neglect of a vulnerable person?
So that caregiver may be over-medicating them or under-medicating them, not taking care of them properly. So those individual investigators will go out and they'll look for those different signs.
Okay. I hear a lot, we used to get a lot of complaints in the nursing home, and I'm sure this happens at homes as well. Bed sores, or I think the medical term is decubitus ulcers. Is that a symptom of abuse, or is that neglect?
Well, we would probably say it's abuse and neglect.
Okay, all right. What about, I have a note here about self-neglect. Is that something the Adult Protective Services will look into?
Yes, the Adult Protective Service does look into self-neglect. This could be an individual maybe not being able to cook, maybe not being able to take care of themselves. They may be over-medicating, under-medicating, things of that nature.
Okay, and they just, they probably need some help in their home.
Yes,
They
they need
haven't
some.
realized that themselves yet.
That's right.
Okay. What about psychological or emotional abuse? Is this something that our investigators look at?
Yes, they do. That can be insults. The caregiver could be talking to them wrongfully, saying ugly things to them, things like that.
Okay. And I know I've seen some of the worst cases in the nursing home setting is sexual abuse. Is that also something that our Adult Protective Service investigators would look at?
Absolutely. They look for bruises, pregnancy, STDs, all of those signs are indicators.
And again, as a former prosecutor, I prosecuted a lot of financial exploitation cases where vulnerable adults and children sometimes had their money taken. Does the Adult Protective Service deal with that as well?
Absolutely. A lot of times the individual representative payee may be mismanaging those funds of that loved one, so we do look into that as well.
Okay. Now, we had a hotline at the Attorney General's office, as I recall, Does the Adult Protective Service have a hotline that folks should call into?
Yes, we do have a hotline that individuals can call in and make a report of abuse, neglect, and exploitation. That phone number is 844-437-6282.
So if anybody suspects they have a loved one or neighbor who may be a victim of physical abuse or neglect, or somebody is financially exploiting them, they can call that hotline.
Absolutely. They can call that hotline and make a report. They can do this anonymously, or they can give their individual information if they would like to.
Okay. So they don't even have to identify themselves if they don't feel comfortable doing that.
Right. That's correct.
All right. And again, that hotline number is 844-437-6282. And I think is it on our website as well?
It is on our website, and we do have a web link. If the individual wanted to make a report online, they can go on our website, go under Aging and Adult Services, and click under the Adult Protective Service link, and there's a web link, and they can make a report there as well.
Okay. Now, your division also has something called the Long-Term Care Ombudsman program.
Yes.
That is dealing with folks in the nursing homes, though, isn't it?
Yes, sir, it is.
Tell us a little bit about that.
In aging, we like to say our ombudsman program is a voice for the residents. So our ombudsman, they advocate for the rights of residents in long-term care facilities and in personal home settings or personal care facilities.
Okay. Now, when you say they advocate for them, what are some of the things an ombudsman, or we have a statewide ombudsman, is that right?
Yes, we do.
Who is that person?
So we have Lisa M. Smith. She is our state long-term care ombudsman.
Okay. What are some of the kinds of things that the ombudsman would advocate for, say, a nursing home resident about?
They would go in and look for the condition of the residents, the condition of the facility. They'll also talk to the residents to see what type of complaints the residents may have, whether that's food or if they feel like maybe activity professional is mistreating them. They'll talk to their different ombudsmen, their local and district ombudsmen that'll come out and do that different monitoring. And then we ensure that these individuals' information is confidential.
Okay. I know from time to time, nursing home residents are asked to leave the nursing home for whatever reasons. You know, either they're disruptive or whatever. They can't get the care that they need. Does the ombudsman get involved in those kind of situations?
Absolutely, they do.
And what would the ombudsman do? Let's say, for example, it's a disabled individual who has just really got a problem with controlling behaviors, and the nursing home decides we can't care for this individual anymore. What would the ombudsman do for that patient?
They would actually go to that individual resident, talk to them, talk to the different administrators in the nursing home, and sort out a resolution for this particular individual.
Okay. And my understanding is that under federal law, and I think under our state law, those residents have a right to challenge the decision by a nursing home to send them out of the nursing home. Is that right?
Yes, sir, that is.
And another part of a former life, I was at Medicaid, and we heard some of those cases. Mm-hmm. Does the ombudsman get involved in those hearings about involuntary discharges?
Yes, they do.
Okay. Now, one of the things I seem to recall came up from time to time, does the ombudsman actually represent the resident like a lawyer would represent me if I had a legal question?
No, they don't represent you like a lawyer, but they do advocate on your behalf.
Okay. And I encountered, it seems like the local ombudsman at these nursing homes, or regional local ombudsman?
So our ombudsman, the district ombudsmen are housed in our AAAs, like we talked about earlier, and then we do also have local ombudsmen that are located in those counties.
Okay. Those AAAs sound like they're pretty busy.
They are. They're our focal point for all of our aging services.
Okay. And is there a number, if somebody feels like they have an issue, they need to talk with Ms. Smith, the state long-term care ombudsman? Is there a number where they can reach her?
Yes, we do have a 1-800 number. It is 888-844-0041.
Okay. So anybody who thinks they have an issue that she could help with, they they can dial up that number and talk to Ms. Smith.
Absolutely. If they can't reach Ms. Smith, they can also reach their local ombudsman, and Ms. Smith will direct them to those ombudsmen.
Okay, all right. Well, I want to talk with you a little bit because, during this past year, we've all had to deal with the impact of the COVID-19 pandemic.
Right.
Tell us a little bit, tell the audience a little bit about what has been the impact there. For example, we already mentioned the congregate meals. We can't have those right now.
Right.
Because our seniors can't congregate safely. What are some other impacts that you've experienced in your division from COVID-19?
The COVID-19 pandemic has really made the individual aging network think outside the box, think innovatively in terms of how we would do traditional services. So we have done things where we would normally have health fairs and different things. We've turned these into parades of celebration where we go out and different caregivers can come through the drive-throughs. We've actually went to different homes and did parades. We've also been doing call reassurance for our older adults, ensuring that we're checking in on them weekly, ensuring that they're okay. We've also, again, like we said, we've changed our congregate meals to those grab and go sites. So we've done a lot of things to think outside the box and make sure that these individuals keep those resources and those resources continuing to flow.
Okay. Now, I get questions from time to time, especially when the legislature's in town, about funding sources. What are some of the funding sources for the Division of Aging and Adult Services?
So our funding, majority of our funding comes from the Older American Act, which is Title III, and then we also use SSBG. We have Title VII for ombudsman programs, and for the Adult Protective Service Program, we use SSBG.
What is SSBG, for those who may not be familiar with it?
That stands for Social Service Block Grant.
Okay, so that's a federal block grant program?
Yes, sir, it is.
And we get, as a state, we get just a set amount for the block grant?
Yes, sir. So we send in a proposed amount of what we would spend for those individual programs, and then they send us back what we're approved for.
Okay. Are the AAAs? I know everybody's concerned right now about when they can get, if they haven't already gotten their COVID vaccine, when and where they can get it. Are the AAAs or the MAC centers counseling people about those appointments?
Right now, they are just providing general Department of Health guidance in terms of Department of Health and also the CDC guidance. And they're also directing those individuals to different sites and then the hotline at the Department of Health.
Okay. So we're basically kind of still encouraging people to make their appointments through the Department of Health, or I think the website is covidvaccine.umc.edu, I believe.
Yes.
So, all right. Are you hearing from your older adult population that they're getting out and getting those vaccines, or you have any sense about where that is right now?
It sounds like that the individuals who are willing to take it are going out getting those vaccines because they are excited about getting back into those congregate sites, adult daycares, and their senior centers, so they can continue those activities that we would normally perform in those centers.
Okay. Well, I know one of the things we were able to do back in the fall was to deliver some Chromebooks to some nursing facilities. Tell the audience a little bit about that whole event.
So we were fortunate enough to get a grant from Administration of Community Living through our No Wrong Door system, which is our MAC center, where we kind of wrote in the grant that we wanted to continue communication for older adults. So to continue that call reassurance and ensuring that those individuals have contact and make contacts with their loved ones, we kind of wrote this in the grant. The grant was approved, and so we distributed the individual funding to our MAC centers, and the Three Rivers MAC Center, they kind of coordinated with the top half of the state to provide those Chromebooks to those nursing facilities in that area.
Okay. And my understanding is that was somewhere around 150, 160 nursing facilities?
Yes, it was.
So that's a good percentage of all the nursing facilities across the state.
Absolutely, yes, sir.
And those residents now are able to use those Chromebooks to to make virtual calls and have contact with their family members?
Yes, sir. They're able to make contact with their family member due to the nursing homes and the visitation restrictions because of COVID, but they are able to access and look at their family members virtually now.
Okay. Wonderful. Just a couple of questions. We've got a little bit of time for a couple of questions. One viewer asked, where can someone find information on all these available resources and services? Where would you suggest, if somebody's just getting into this issue of dealing with an elderly adult and all these resources that they need, where should they start?
I would encourage them to call their MAC centers. These are trained MAC center specialists, and they have a resource database with the list of resources that's available to them, and they can just kind of call in to the MAC center, explain their situation to that MAC center specialist, and that MAC center specialist will be able to route them to the appropriate resource.
Okay. And anybody can call the MAC center?
Anybody can call the MAC center, yes,
There's
sir.
no income threshold requirement for you to access those services?
No, sir.
The state health insurance program, the SHIP, same thing there. Anybody can call the SHIP and get assistance about Medicare, Medicaid issues?
Those individuals that are Medicaid eligible or their caregiver and their representative, if they are calling just to receive information, yes, they can call as well and ask to speak with a SHIP counselor.
Okay. So we're really just trying to get people in contact with the resources that
Correct.
they need.
Yes, sir.
Okay. Give us a sense, if you have an idea, how many people, like in the last year, do you have any idea how many people accessed our SHIP program at all?
I don't.
Okay. All right. Well, the MAC centers, there are 10 of those around the state. Is that right?
So there are 5 MAC centers
Oh, there are
around.
5.
Yes.
Okay.
Yes.
Okay. So it's not one at every AAA.
No, it's not one at every AAA.
Okay. All right. And are those identified on our website? Do you know?
Yes, they are listed on our website.
Okay. All right. Is there, if someone wanted to apply for the Respite Voucher program, is there some kind of application on the website, or do they just go to the MAC Center and give their information to the MAC Center?
So we do have an application. They can call the MAC Center and just let the MAC Center know that they're interested in receiving a respite care voucher, and so the MAC Center, they will mail them the actual application.
Okay. The Adult Protective Services program, who operates that program right now?
So our investigation portion of the Adult Protective Services is contracted with our planning and development districts.
Okay. And they prepare the reports, and they are in regular contact with us, with
Yes.
your division, I assume?
Yes, sir. They do the entire investigation. We have a system that's called WellSky. All the information, all the reports, that information is in there. We do retain our APS hotline, our APS Q&A specialist, and also our Adult Protective Services director.
Okay. Do some of those reports wind up actually being referred to law enforcement authorities?
Yes, sir, they do.
Okay. And may or may not be prosecuted ultimately?
Right.
Okay. All right. Well, I think we're getting close to wrapping things up. Kenyatta, it's been a pleasure visiting with you this afternoon. I want to let our audience know that our next town hall will be next Thursday, March the 4th. It's going to move back earlier in the day. It'll be at 9:30 a.m. And joining us next week will be Chad Allgood. He is the director of our Division of Early Childhood Care and Development. He's going to be talking with you about our child care program. The Department of Human Services operates a child care voucher program for particularly our TANF population, but he'll talk to you about some of the other benefits that we offer through the child care division. Anything you want to add before we wrap things up, Kenyatta, about the work that the Division of Aging and Adult Services does?
Sure. I just want to encourage everyone who's listening today, if you know someone and you need available resources for older adults, persons with disabilities, or vulnerable adults, to please call our MAC centers and reach out to us.
Great. All right. Well, again, thank you for your time this afternoon.
Yes, sir.
Really good information, and I hope folks will do just what Kenyatta said. Take advantage of these services that we make available. They're to make your lives easier and give you some relief from some of the responsibilities of taking care of elderly adults, and we're here to help. So, well, we'll see you again next week, 9:30 on next Thursday. We'll be talking about the child care program and the Division of Early Childhood Care and Development. Thank you very much.